Hello everybody, this is Mrs. Ronsley. I thought it might be useful for us to really have a clear guidance on what to do if we have suspected COVID symptoms with our children or a member of our family. I thought this would be useful for you. So first, the symptoms for COVID-19 are high temperature. That's feeling hot to touch on the chest or back. A new continuous cough, so basically coughing a lot. A loss or a change of smell or taste, not being able to smell or taste anything, or slightly strange. Now it's very important that when we use this language, if your child is just not feeling very well because they're a bit snuffly or they're a bit of a sore throat, we need to be careful about using the word temperature, cough or change of taste, because for us in school that means you will need to have a test. So what do we do if our child has got those symptoms? Firstly, do not come into school. That's very important. You keep your child at home. Secondly, phone us and tell us that your child is off because they have a high temperature and or a continuous cough and or a loss or change of smell. Get a test. Now at the moment, getting a COVID test is really difficult, but you've got to keep trying, because we can't have your child in if they have those symptoms unless they have a test. We need to know. We need to know because if your child is positive, we need to then send home all the other children in your child's bubble. Your household will need to self-isolate for 10 days if you have COVID and 14 days if you haven't got COVID but somebody in your household has. You phone school as soon as your test result comes in, positive or negative. We need to know. And your child can return to school when the test is negative. If your child tests positive for COVID-19, what do you do? Well, you do not come into school. Please don't come into school. We need to make sure that everybody is safe. You phone the school to tell us. And then your child that is positive needs to self-isolate for 10 days minimum. That is what the government say is the time for you not to be infectious anymore. But everybody else in the household must self-isolate for 14 days. Then, if your child is positive, we will need to then collapse the bubble that your child is in. So every other child in your child's bubble will then be sent home and remote learning will be given. And your children can return to school after 10 days, even if they still have symptoms, as long as they'll no longer be infectious. But everybody else will be self-isolating for 14 days. What if your child has a test and they test negative? Well, you contact the school to inform us that you have a negative test result. And then your child can come back to school when they feel well enough. So that might be the next day, it might be a couple of days. If your child is ill, but they don't have symptoms of COVID-19, so let's think what that might be. So that might be sickness and diarrhea, it might be a sore throat, it might be pains, it might be a headache, but they're not COVID-19 symptoms. So we just follow the usual school absence policy procedure. You keep your child off, you let us know, and then your child can return to school after they're better or after 48 hours following the last sickness or diarrhea. What if somebody else in the household has COVID-19 symptoms? That might be a mum, a dad, sisters, brothers, aunties, uncles, grandparents, somebody who else lives in the household. Well, do not come into school, please, because it could be that that person in your household has COVID-19. You contact the school and tell us. Then that member of the household needs to get a test. The rest of the household need to self-isolate until the test results are back. And then you let us know the test results of that household member as soon as you get them. And if the test is negative, you can come back to school. What if someone in my household tests positive for COVID-19? So again, that might be a mum or a dad or a grandparent or an auntie or an uncle who lives in your house, or other brothers and sisters. Don't come in to school. Contact school and let us know. The household will then need to self-isolate for 14 days. And then after 14 days isolation, you can return to school. What if the NHS Test and Trace have contacted you and identified that your child might have been in close contact with somebody who has confirmed COVID-19? So close contact is coming within 2 metres for more than 15 minutes, being within 1 metre with somebody with COVID, or being in a car, a small car with somebody who's COVID. Do not come into school. Contact school and tell us that Test and Trace have told you. The household then need to self-isolate for 14 days. And then you can return to school after 14 days of isolation. What if you travel and you then need to quarantine? So quite a number of countries around the world, when they return from that country, you have to go into quarantine for 2 weeks. Check if that country of travel is on the government quarantine list, and it keeps changing quite regularly, so make sure that that country, if it's not on the quarantine list, then your child can come back to school. If it is on the quarantine list, then you must self-isolate for 14 days. And you can return to school after 14 days quarantine. My child has been told to shield by the doctors. So if your child has a very life-threatening condition whereby they need to be away from other people, then your doctors may tell your child has to shield. Do not come into school. Contact school and tell us what the doctor has said. And then you must shield until you're told not to by the doctor. And then return to school when a doctor says your child can return. Now, if your child's bubble has to close because a child in your child's bubble, there is an outbreak of COVID-19, your child will not come to school. The school will supply home learning for the 2 weeks that the children must isolate for. And then, after 14 days, the bubble will reopen and your child may return. What if you have more than one child in our school? Please remember that if one of your children is displaying COVID-19 symptoms, then all of your children must stay off. Even if your children are at another school, such as a secondary school, they must all stay home even if only one of your children has symptoms. Then you must test your child, and then if that test is negative, all the children may return to school. It's very important that we all make sure that we're clear about our children's symptoms, and as a school we are doing our utmost to keep your children and our staff safe. It's testing times for us all, but I would like to send you all a massive thank you for this 1 week we've been back. You have been so supportive, and you have really worked with us as a school to keep everyone as safe as we possibly can. Thank you everybody. Take care. See you soon.